Hello and welcome to the special broadcast called Looks Can Kill. And we mean it quite literally. I'm Chaiti, Narula. A young, bright, talented actor, all of 21 years of age, wanted to get a simple liposuction. In simpler words, fat removed from her body. She went in for the surgery in Bengaluru and she never returned home. A young actor with tremendous potential and an entire career ahead of her, just gone. Just vanished like that. Something went wrong in that surgery. While we will clear all the frequently asked questions about these cosmetic procedures with the best of the best doctors in this country, let's first get you this report.
A bright young life with immense potential, lost to a fat removal surgery in Karnataka. Death of a 21-year-old Kannada star has sent shockwaves across the state. Chethana Raj died a day after she underwent a liposuction plastic surgery in Bengaluru. She developed complications as fluid began to accumulate in her lungs. Her surgery did not go as planned. She had a whole life ahead to fulfill her starry dreams. The news of her death came down heavily on her parents. Chethana's parents were reportedly unaware of this surgery. The Kannada star went for fat removal surgery with friends. The doctor had reportedly removed 3 liters of fat from her body. Her family says Chethana, who was in perfect health, was under peer pressure after being branded overweight.
ಹಾಗಾಗಿ ಅವರು ಯಾರು ಹೇಳಿದ್ರಲ್ವಾ ಅದಕ್ಕೆ ಆ ಫ್ಯಾಟ್ ತೆಗ್ಸೋಣ ಅಂತ ಅಂದ್ಬಿಟ್ಟು ಸರಿಯಾಗಿ ಅಲ್ಲಿ ಇದೇ ಇಲ್ಲ ICUನೂ ಏನೂ ಇಲ್ಲ ಸುಮ್ಮನೆ ಮಾಡಿಬಿಟ್ಟಿದ್ದಾರೆ ಆಪರೇಷನ್ ಮಾಡಿಬಿಟ್ಟಿದ್ದಾರೆ ಶ್ವಾಸಕೋಶದಾಗಿ ನೀರು ತುಂಬಿಕೊಂಡು
आई वांट टू नो ऐसे कौन सा हॉस्पिटल है ऐसा कौन से डॉक्टर्स है कि प्लास्टिक सर्जरी में शी वाज जस्ट 21 ईयर ओल्ड ऐसी कौन सी सर्जरी कराई जिसमें उनकी मौत हुई दिस इज रियली शॉकिंग
Slamming doctors for their daughter's death, her parents have now lodged a police complaint. Surgeries and diet regimen to lose weight can sometimes turn fatal, as was the case of Bengali actor Mishti Mukherjee, who died of kidney failure caused by the keto diet she was following. Did medical negligence kill a budding star? Or was it pressure from the society to look slimmer that killed her? Or was it the idea of a starry world that led to her untimely demise? A young life snatched away. Will the glamour world learn any lesson?
The death of Kannada actress Chethana has sent shockwaves in the film industry and has once again brought the question of the beauty standards existing in the industry back to light. With bureau input, this is Karthik for India Today, Bengaluru.
Many of these cosmetic surgeries, nose jobs, liposuction procedures, Brazilian butt implants are all successful. And if you want to get them, the best board certified doctors should be your pick, who even first decide if you are the right candidate for it. But there are some who still get them done and they don't turn out fatal but go awfully wrong and embarrassing. Here are some of the examples. Plastic surgeries and liposuction can go really awry for some. Kannada actress Chethana Raj dies after going through a liposuction today. A wrong nose job or trying to get an hourglass figure can go wrong. Sometimes, if a proper qualified doctor does not do the job right, you may have fatal results. In other cases, your career almost ruined. Jennifer Grey almost ruined her career trying to get a nose job that went wrong. Darcy and Stacey Sylvia have been left looking unrecognizable after going under the knife. Body sculpting has often costed lives. You need to be sure if you're the right candidate before rushing off to get that excess fat off or getting your body sculpted to look like a Kardashian who has been slammed by university reports for creating body image issues as influencers. Even Linda Evangelist's lawsuit has amply shown the world the dangers of plastic surgery. She was on the cover of almost every fashion magazine. She was every big designer's ultimate muse. That is, until a procedure gone wrong caused her to halt her career and retreat from the spotlight. A denial of aging is creating mental health issues along with fatalities. Not to say all plastic surgeries are bad or they do go wrong. A good board-certified doctor goes through multiple evaluations before giving you bigger breasts or reducing your fat or fixing your nose or giving you a Brazilian butt implant. Sadly, many clinics have mushroomed trying to keep up with the times and are responsible for some dreadful results. Kenny Rogers, Joan Rivers, Donatella Versace, Michael Jackson, Jocelyn Wildenstein, Carrot Top are just some faces that look bizarre after plastic surgeries, and you can see them for yourself here. In New Delhi, Chaiti Narula for India Today. Two celebrity cosmetic dermatologists now join me on the broadcast. I'm very happy to welcome Dr. Rashmi Shetty and Dr. Kiran Sethi as well, who are joining us to discuss this very important issue and answer the frequently asked questions as far as cosmetic procedures are concerned. To you first, Kiran. Kiran, we saw the grim news coming in this morning and everyone woke up to that grim news. The fact here is many people get liposuctions done. We don't want to name anybody, but many from Bollywood to Hollywood, everybody gets liposuctions done. While there are certain risks associated with liposuction, some of them are even very successful. If you could tell us the do's and don'ts and explain the lay of the land as far as liposuction surgeries are concerned.
Absolutely. So liposuction can be done a bunch of different ways. There is tumescent liposuction, where they simply just do it while you're awake. There's also liposuction done under general anesthesia. Basically what you do is you insert a probe inside the skin in the fat layer and you suck that fat out and then you close up that incision. And the anesthesia is important, how much you remove is important. Also, you know, what kind of candidate are you for this procedure? Do you have any comorbidities? Do you have diabetes, blood pressure, any other issues? The other things that we consider are, because any procedure you do has a risk profile, nothing in life is risk-free. We want to make sure that in case of something adverse happens, that we have all the facilities available to help treat that adverse event. And we should be aware, we should have good doctors, we should have a good team, we should have a good hospital, we should have everything right there in case anything goes wrong. Liposuction has a 0.5% risk of death. It's very, very low. So, you know, if it happens, it's rare. And a lot of things are also quite avoidable, but it's not 100% avoidable.
Dr. Rashmi Shetty, I'd like to ask you, in terms of getting a liposuction done or a fat removal done, are there risks of pulmonary embolism? That means blood, there is water that can accumulate into your lungs and then you end up losing your life, just in case of what happened with this 21-year-old girl. Is it very essential to first see the qualifications of who you're going to? They need to be board certified. What are the do's and don'ts that you need to remember in mind before you even select your right doctor?
So the first thing is, one, I think we as a community should make the taboo around this go away. Anything which is attached with the taboo, then you're not actually doing your homework well, because you don't need to ask. Everything is hush-hush. So in that hush-hush, you choose wrong, you do wrong things, and that's how things go wrong in aesthetic procedures mainly. So first thing first, I think we should be able to empower people to choose if they want to do whatever they want to do with their bodies, their faces.
Yeah.
Once that's empowered and not looked upon as vain, then people are open to ask the right questions.
Right.
Then, of course, the first right question is go, like Kiran also said, go to the right doctor. Don't hesitate asking the qualification of your doctor, because a lot of times this has become so business-like that also you're scared to ask your doctor. How do you ask your doctor what your qualifications are? But that's fine. Please ask your doctor. They have to be board certified. They have to be either a dermatosurgeon, a dermatologist who's trained to be a surgeon, or a cosmetic surgeon, or a general surgeon who's also trained to do liposuction. So that's your first homework that you end up doing. And then you talk to your doctor to show you some before-after pictures, how many procedures have they done, and make sure the center looks like a legit center and it is a hospital, which is important.
I'm so happy you mentioned that the center should look like a legitimate center, and the qualification of doctor matters a lot, and ask up front about the qualifications, because here you've got your life at risk. Dr. Kiran, there are so many of these cosmetic procedure centers that have mushroomed all over the country, and they almost operate like factories, giving these fat discounts and, you know, make you give you this hope of looking like a Kim Kardashian when you walk out, and they can be very seductive in many ways. My question here is, one, if you could tell our viewers who needs it and what they need to do before they go into any kind of procedures, and how they need to not get carried away by all these seductive ad campaigns that they end up seeing.
Oh, that's a great question. So let me break it down. One is who should get it. Now, the people that should get it, you know, there would be a certain amount of BMI that's a minimum and a maximum that should get liposuction. Also, do you have any other health issues? Have you ever had any adverse events to anesthesia? These are all questions you would ask. The second thing is, I would go in, and I would not immediately go in an impulse. Nothing done in an impulse is usually correct, especially when it's surgical. I would go, I would meet doctors, I would meet 2, 3 doctors, I would hear them, I would ask them, you know, obviously their qualifications, but I would also ask them, how many of these procedures have you done? And out of how many of them did you have an adverse event? And what were the adverse events that are possible? And what have you dealt with? I would want to know all of these details, because before I do any surgical procedure that is optional, liposuction is an optional procedure, I want to know exactly what I'm getting into. Am I okay? Am I okay with taking on these risks? And if I am, then I want to know that the doctor I'm with knows how to deal with them. And then the third thing is, I would want to know that the facility has all of the emergency needs in case a problem happens. And I think that's really key. The fourth thing is, I would definitely take the advice, go with somebody or take the advice of somebody else, and bounce off the concept that you want to do it with, bounce off the concept that you want to do this thing, and then really get a clear decision that you're going ahead with something that has a small risk, but that you are clear that you know you want to do it, there's a reason why you want to do it, and you're willing to bear the cost in case it goes wrong.
And Dr. Kiran, what do you have to say about people like Kim Kardashian, who have really gone ahead and you know, gotten Brazilian butt implants done? There are celebrities who look like they have the hourglass figure. They've popularized it a lot. We do know of many Bollywood celebrities who have gone under the knife as well. Is there a lot of pressure to look a certain way these days in society? Because even what I've heard is, before all these songs that the Bollywood actresses are shooting, they go for a liposuction to look a certain way and then end up shooting it. So there is just way too much pressure, I feel, in society now to have a certain figure, look a certain way. And I believe that there are few non-invasive procedures as well that can give you the same result.
So body image and the perception of body standards is huge now, and social media has just mushroomed this. You know, we used to be scared about body standards with magazines, but social media has taken it to a different level. And yeah, Kim Kardashian is out there and she's promoting this specific body, and her own sister at the age of, what, a teenager, she created her own body as well, same way. And to see that, unfortunately, then you see all these young women that are saying, hey, maybe this is okay, maybe this is what I want to need to be in order to be loved or liked or accepted. And I think this is a conversation that people need to have with their children, with their friends, with their family, that, you know what, this standard is not acceptable, that people have the right to have all different kinds of bodies, and it's lovable and appealing and attractive no matter what. So conversation about standards is deeply important. And then yes, is it prevalent? Do people get a lot of these procedures? Absolutely. Is there a risk profile? Of course. It is a low risk, but it exists. It's so important to go to the right place and be in the right hands and to spend that extra money or that extra time understanding.
That is the very important point. Many patients try to cut corners, and hence a lot of these surgeries or procedures really end up going wrong. Dr. Rashmi, I want to even come to you. We're not saying don't get any of the procedures done. If it suits you, hey, who are we to judge or decide whether they want to get it done or not? And if they want to look a certain way, please go for it. It's just one life. My point here is there are many that do not turn fatal, but they go awfully wrong. I can give you examples of Donatella Versace, Kenny Rogers. You've got so many, right? There was a recent lawsuit as well of Linda Evangelista, if you remember. And all of them have gone wrong. Why does this happen?
So I think one, with the pressure, like I earlier said, people don't do enough homework and it's all hush-hush. So you end up going into the wrong hands. Two, please don't look for bargains in this at all. Like you rightly mentioned, they make it attractive, they make packages, don't go to places just for the sake of a cost. You go to a doctor for the sake of her graduation, her qualification, her experience and her expertise, not for her cost. So this is very important for you to choose. And again, like you rightly said, it's okay to want to do what you want to do. But then is it the right thing to do? Is it the right place to do? Is what determines it all. There are a few times when I think you need to listen to the doctor as well. Patients can get pushy at times. That's where a senior doctor comes into play who knows to say, no, this is not what you need. You may want it, but this is not what you need right now. And this is what may not look good for you today on your face. And it may not cumulatively give a good result in the long run. So this is something a doctor needs to be saying and take charge of what she's doing onto you, rather than leave maybe, you know, youngsters or people who are not fully aware to take charge of what should be done onto your face.
Dr. Kiran, there are many other safer ways to get the same result as well, if I'm not mistaken. And recently there was a death in Delhi because of a hair transplant as well. And I do know that in your practice itself, you get a lot of clients walking in, wanting to look a certain way and achieve that perfection, but you do turn them down because of the risks involved. And maybe those particular patients do not have the right kind of vitals to even go through all of that.
Well, at my particular center, we say no a lot if we think something is not going to be aesthetically proper, or we don't think we're going to get a good result, or, you know, we think the risk is too high. If somebody has a lot of health illnesses or they're not a candidate for something, then we obviously will say no. And saying no is the most important thing very often a doctor can do, especially in the aesthetic world, as Dr. Rashmi said. There are ways to do things non-invasively with obviously no risk of death. There are machines that do fat loss, for example, sculpture, and there's cool sculpting, and there's many different machines out there. They do improve the fat loss without really any undue side effects. They are comfortable, but can they give you the same result as surgery? No, there's a reason why surgery exists. But for those who don't actually require that much, maybe just a little bit of fat, a bit of contouring, some tightening, a lot of non-invasive options are out there that without that risk. So, you know, it's great because in the aesthetic world, there is an invasive world with surgeries, but there is a non-invasive world that is rapidly approximating the results of surgery. So it's quite exciting because we can sort of, you know, remove a lot of the risk and give a lot of the benefit.
And my last word from Dr. Rashmi Shetty before we let you both go is on the procedures that go wrong and end up ruining careers, and hence, what is your advice to all the people listening in today?
So one is go easy and don't believe everything that you see on the internet. All those faces, all those butts, there's a lot of Photoshop going in as well. So don't believe everything, and there is no standard for beauty. It's just being the best of yourself. There is no standard to measure and live up to. And please choose a safe practitioner, a qualified practitioner. If you have to, nobody is judging that.
All right. Thank you so much, you ladies, for joining us with those important FAQs that you have really addressed and shed some light on these procedures, and more importantly, educated our viewers on what to keep in mind before going through any of these drastic procedures. Thank you very much once again for joining us on this special broadcast.
Thank you.
With that, it's a wrap from me, Chaiti, Narula. Keep watching India Today.